Good morning, everyone. Today I'm going to present my paper on the topic Proportion of Mask-Associated Dry Eye Symptoms Among Healthcare Workers and Laymen. My aim is to estimate the proportion of ocular complaints associated with face mask among healthcare workers and laymen in a tertiary care center in South India. Materials and methods. It was a cross-sectional study and 70 each from healthcare workers and people accompanying patients who came to ophthalmology department was taken. The study period was from October 2021 to April 2022. And I have divided this into two groups. Group 1 include laymen, people, including the people accompanying patients wearing face mask occasionally less than 6 hours. And group 2 including healthcare workers of the institution wearing face mask for extended period more than 6 hours. And non-health personnel with extended mask use like shopkeepers and police department, and systemic disease associated with dry eye like Sjogren's syndrome, and those with history of post-COVID illness and ophthalmic lubricant users, and with extended digital screen users, with past ocular surgeries, with contact lens users, and history of ocular adnexal disease which alter the tear secretion were excluded from the study. And the procedure, healthcare workers and laymen accompanying patients were randomly selected, 70 from each group, and informed consent was taken. History regarding the duration of mask use and the symptoms of dry eye were assessed using Ocular Surface Disease Index. And they were requested to fill up the standardized OSDI index questionnaire of ocular symptoms related to dry eye. It is a 12-item questionnaire designed to provide a rapid assessment of dry eye symptoms and their impact on vision-related function. OSDI score was calculated with subtotal score multiplied by 25 divided by number of questions answered, and those patients above 12 points were considered as with ocular symptoms and below 12 points were considered as normal. And this table shows a baseline demographic details regarding the age and all, and for both the healthcare workers and laymen, there is no statistically significant difference between both the groups. They are comparable. And the statistical analysis was done with SPSS version 20. Qualitative variables were expressed as frequency and percentages. Proportion of dry eye symptoms were expressed as percentage. P-value was calculated by chi-square test. P-value less than 0.05 was considered as statistically significant. Regarding my results, proportion of dry eye symptoms among healthcare workers and laymen based on OSDI questionnaire. And among the healthcare workers, 49, that is 70% were having this ocular dry eye symptoms, whereas laymen 27, that is 38.6 were considered as without ocular symptoms. And there is a significant, I have noticed a significant difference between both the groups, healthcare workers and laymen, because this p-value is less than 0.05. This is a bar diagram that shows a proportion of ocular symptoms among healthcare workers and laymen. This brown that shows with ocular symptoms, healthcare workers, and 27 that is with ocular symptoms in laymen. And this table shows each type of ocular symptoms, proportion and significance, like foreign body sensation, burning, watering, redness, and blurring of vision. And I have noticed a significant difference between both the groups, healthcare workers and laymen, except for blurring of vision. And this is a diagram, a bar diagram that shows each type of symptoms. For all the symptoms, for all among the healthcare workers and laymen, foreign body sensation is more seen and blurred vision is less seen. And discussion, a recent review in ophthalmology therapy described a marked increase in dry eye symptoms among regular mask users, and dry eye symptoms may become a problematic for a significant percentage of population. Even individuals who have not previously had dry eyes are exhibiting dry eye symptoms with mask usage. Those who wear mask regularly for extended period each day or full time may exhibit more symptoms. Among healthcare workers, those with symptoms are more than those without, and among laymen, people without symptoms are more than with symptoms. In a study mentioned among the participants, 8.3% of regular mask users of ordinary mask and 20.8% of healthcare workers and 4.17% of ocular users, they reported that they had started using lubricating eye drops because of symptoms and they are getting reduced. In a pilot study with 144 people, 70.1%, it's done by Evelina Marina, reported that ocular symptoms including burning, redness, tearing, foreign body sensation, itching, blurred vision, dry eye feeling, and undefined eye discomfort. The limitations of my study, short follow-up period and small sample size. Conclusion, according to the study, proportion of mask-associated ocular complaints among healthcare workers were more than laymen. Of all the dry eye symptoms, occurrence of foreign body sensation, burning, watering, and was found to be more in both the groups and more among healthcare workers than laymen. Awareness regarding the more proportion of dry eye symptoms among prolonged face mask users that help us to take necessary steps to prevent the development of dry eye disease. And these are my references. Thank you.
That means you advise no mask. You advise, not to wear masks.
No, sir. We have to avoid mask, and in association with, we have to use the lubricating eye drops. Actually, I have this dry eye problem.
You have.
Did you compare between the surgical mask and the N95?
Yeah, I didn't find that much significance between both the surgical and types of mask. But mask associated, there is symptoms I have noticed.
How is that a mask causing dry eye? What is the mechanism?
Because with the usage of mask, the outflow of the exhaled air is obstructed, and which can cause the hot air to flow through the ocular surface and can result in more evaporation of the tear film, lipid layer, which can cause dryness.